Hi, my name is Simon. I'm a nursing student, and through this video, I'll attempt to pass on a little knowledge about drug calculations. Drug calculations are an everyday task performed by a nurse when preparing to give a patient medication. A registered nurse is required to perform drug calculations test as part of their annual competencies required for registration. In looking at the standards that are published by the Nursing and Midwifery Council Professional Practice, drug calculations are looked at in Standards 4, participating in ongoing professional development of self and others, and Standard 9.5, applying relevant principles to ensure the safe administration of therapeutic substances. There is a very simple equation used for drug classification. The way I like to think of it is doc over stock times the quantity over 1. Doc, what the doctor has ordered; stock, what the actual medication comes in, and the quantity that is required over 1. Remembering that we need to make sure that the dose required and stock available need to be in the same unit of measurement, otherwise administration errors can occur. These calculations can appear mechanical at first for the new nurse or student, but over time and with competency and practice in the area, these calculations can be done in your head. When teaching and learning about drug calculations, especially when it's a new concept, it's important to suggest that the nurse show all their workings to get to their answer. This way, if an error occurs, it is easy for the assessor to realize where they went wrong to help in understanding and correcting the student. Here are a few examples. Number 1, but at this stage, you would have looked at the doctor's orders, assessed what the drug is, whether the drug is still appropriate, and why it's being ordered. It's probably worth underlining the two amounts of drug asking for, as they're both, and are they both in the same volume, as highlighted here. If not now, is the time to change this. Now write your equation, showing all your workings out, and once you've your answer, make sure it's written either in tablets, mils, or grams. Now we can go through a few examples, and hopefully answer all the questions with them. The patient requires 50 mg of prednisolone. Tablets are in 25 mg. So we have our two values. What the doctor ordered is 50 mg. We have our stock, 25 mg. The quantity, we're dealing in tablets. Tablets, 1 over 1. This equals. So 25 is our lower denominator. It can go into 50 2 times. 25 into 25 1 time. Times the 1 over 1 times 1 equals 2 tablets. Example 2. Patient requires 125 mg of an antibiotic. The antibiotic elixir is 250 mg by 5 mils. So we now have 3 values. So what the doctor order is 125 mg. Over the stock we have is 250 mg. Times the volume or the quantity that it's in is 5 milliliters. We can break this down. 125 goes into 250. How many times? 2 times. 125 goes into 125 1 time. Times the volume, 5 mils. 5 over 1 is still 5. So half of 5 mils equals 2.5 milliliters. Okay? I hope this provides a little more understanding or eases drug calculations for you. Appreciate your attention.